How do you determine how many times you should exfoliate weekly based on dry, combo, oily skin? So part of it is how sensitive you are and what type of exfoliant that you are using. Sensitive skin can be tricky because you don't want to inflame the skin, especially if they have rosacea or telangiectasia, which is like, broken capillaries. So here is a clue for people who tend to have oilier skin. If you tend to get like those flesh-colored bumps on your skin, which is a desquamation issue, you should be exfoliating more, because basically what that means is those bumps that you have, it's because the dead skin cells are not, they're getting clogged in there with the oil. So it's not a bacterial issue, because if it was bacteria, it would be red and have pus in them. And they would start to hurt even. So the ones that are just congestion, that needs more. And then combo skin, you can even exfoliate in the areas that you tend to be oily more, which is the forehead, nose, and chin area as well. So I tend to exfoliate less in the summertime, and then I exfoliate a little bit more in the winter time, and then try to hydrate and keep my skin more moisturized. How do you close or tighten pores on dark skin? I think you mean tighten the pores on dark skin. In the pores, you're producing sebum. And if you're exfoliating, it lets the oil come up onto the top of the skin and spread more evenly. If you're not doing that and it doesn't dissolve the skin, it can stay in there, which then eventually becomes the sebaceous filament, right? Because it's solidifying. When it's in the pore and it stays in there, it will make the pore appear larger because it's stretching out, right? Because the waxy substance is inside the pore. So when you extract it, or when you're exfoliating it, it can come out freely, then obviously it gets smaller, right? So it appears smaller or smoother. Which is worse for normal to dry skin using tretinoin? Trans epidermal water loss or putting a barrier cream on or before tretinoin. I don't experience irritation letting skin fully dry first. Hopefully I understand it right. If you are experiencing TUL, trans epidermal water loss, due to the tretinoin, you need to put the tretinoin on first, always, and then you can put a barrier repair cream on after the tretinoin. Because when you use a lipid-based product, it inhibits absorption rate, if that makes any sense. Water-based products or thinner products need to go on first on your skin. Then you can put on your cream. You don't ever want to put the cream on and then like a vitamin C above it, or like, hyaluronic acid. It needs to go on first. Eye cream really necessary if you have a good serum and moisturizer. Okay, so if you've ever noticed eye cream, it's in these like small jars or tubes or whatever. It's more expensive per its size, right? More than like a cream. And it's one of the reasons why is because generally speaking, I can't speak for every eye cream or product, it has more concentrations of peptides in there, or emollients or hydration things in there. So that's why. Is it recommended for everybody? No. If you have like crinkly eye and it's really dry around here, some people are really prone to dryness around here, then yes, that it certainly does help. If you're like 20 years old and you have no fine lines or wrinkles, and you're looking at this $80 eye cream, no. Do you know if it's better to use an oil or a face butter at night time over a moisturizer? Okay, so this is a tricky question because oil has the lowest amount of humectants. If you're talking about a moisturizer, meaning like a lotion or cream that has a balance of humectants, emollients, and occlusive agents, then once you put that oil on, you don't really get the benefit of the moisturizer, if that makes any sense. So again, I don't know what you mean by moisturizer, like a lotion or a cream, but it's you would typically put the moisturizer on first and then the oil, not the oil first.